I'm too young to have dental implants. What can I do about my missing teeth? Hi, I'm Dr. Ash, implant surgeon. I'm here to answer your biggest questions about missing teeth and dental implants. Okay, so this is a very, very real thing. If you've been following our videos, you'll know that one of the main reasons that you can have missing teeth is because you were just not born with them. Very, very common, particularly in the upper anterior region. So let's try and imagine what that must feel like. You're a teenager, you've just started a new school, for example, and you've got two teeth right at the front of your mouth that are missing. That's going to be quite difficult to deal with. So the first thing to point out here is you are absolutely right. You can't have dental implants not until the jawbone and the gums have matured, which is roughly, for most people, in the mid-20s. So what can we do? How can we fix this problem? The first thing is you can fix it very, very simply using a removable denture. Now, I know that doesn't sound nice, but as a dentist, having a removable denture made for a patient is actually a very simple and effective treatment. It's not really confidence building for the patient, I appreciate that, but it's really, really easy to make, it's easy to repair, it's very, very cost effective, and I think it's a genuine option that parents should consider. The second option, which is probably a lot better and I think should be available by any single dental practice, is what we call resin bonded bridges. These are also called Maryland bridges. It is basically a pontic, which is a prosthetic tooth attached to a wing. Usually this is a metal wing, which gives you a little bit more longevity, but it can now be made from more aesthetic materials. And we literally stick those bridges on the underside, on the inside of your teeth to replace the gum. Okay? Very, very effective. Can be long lasting, although generally speaking, it is more of a short-term option, but in the big scheme of things, you just want to get through your teenage years to your mid-20s so you can have a more definitive solution. The final thing, which kind of coincides with another treatment, is if you are having any form of orthodontic treatment, which is very, very common. I think 2/3 of teenage children have some form of braces therapy. You could incorporate some false teeth within your brace system, whether that's a fixed brace or whether it's clear aligners, and that could help resolve that problem. So just to summarize, you're absolutely right. Implants are not an option for teenage children, and really the best ways to accommodate this are removable dentures, acid etch or Maryland bridges, and some orthodontic treatment. If that was helpful, please like and subscribe to this video. See you next time.